Good evening, sir.
Good evening, doctor.
Dr. ATMARAM is with us. He was in Apollo before and now he is associated with MGM Chennai. Welcome, sir.
Thanks for inviting, doctor.
Thank you, sir. So let's go ahead immediately to the discussions. We'll be discussing everything in and out as per your priority in MI. Being a
Okay.
physician, you can go ahead and explain.
Okay. So MI is an abbreviation for myocardial infarction. General public might not be aware what myocardial infarction is. Of course, all are aware about heart attack. Heart attack is the common man's term for medical term myocardial infarction. This heart attack is due to chronic occlusion developing in the blood vessels which supply blood to the heart. This is not an instantaneous process. This process would have started occurring at least 5 to 10 years before the person had a sudden heart attack. So there is a good window of opportunity to prevent this from happening.
Yeah, definitely. They've invested a sufficient amount of time in manufacturing a lot of diseases so that by the time in 1 to 2 decade, they have everything manufactured in their body and they're ready for multiple diseases and everything throws one by one. Is it, sir?
Yes, yes. Patients frequently ask, how did I get attacks? See, till yesterday I was all right. Till yesterday I went to work. How did this develop suddenly? That is the question we frequently get asked by the patients. This is what we say. You have been having a bad lifestyle at least for 15 to 20 years before you had this sudden attack, as you said.
Yeah. And they think it is of course, it's silently building up, but it's not all of a sudden, unless in very minimal number of cases, almost 99.9% is all created slowly by the type of lifestyle. Please go ahead and so what are the symptoms of cardiac attack and heart attack or cardiac arrest? So how to differentiate from other system illnesses like musculoskeletal and gastric symptoms, sir?
Yes. The patient who has got the occlusion of the blood vessels which supply blood to the heart will have exertional chest pain. What we mean by exertional chest pain is when the person tries to do some work like climbing stairs or after having a heavy meal, all the blood supply will be diverted to the muscles in the case of walking and to the gastric system, digestive system in the case of a heavy meal. In that case, blood supply to the already jeopardized heart is furthermore reduced. That is why the patient might have chest pain during activity or chest pain after a heavy meal. This is called as angina. In a heart attack or myocardial infarction, patient experiences pain during rest itself, sudden severe pain during rest due to complete blockage of the total 100% blockage of blood supply to the heart. Total 100% blood supply blocked in blood supply to the heart.
Yes, definitely, sir. And is there any alarming symptoms which are more relevant to cardiac disease than to other system, which the patient should be able to identify early, so that they report early and get any
Yeah, that
sudden
is.
attack? Yeah.
So the typical symptom is chest pain, which occurs due to activity. This is angina. Of course, in myocardial infarction or heart attack, there is sudden chest pain given during rest. It most commonly occurs in the early morning. That is when the adrenergic system, the stress system, wakes up. So at that time, the blood pressure will be more, and the chances of having a heart attack is more during the morning period.
Yeah.
Of course, how will you different? The most common other reason for chest discomfort is gastric discomfort. The stomach acids sometimes might regurgitate back towards the food pipe. During that time, also patients might feel a chest discomfort. This type of discomfort is usually occurs after a heavy meal, and it will get relieved with antacids and other things. It is not a very severe pain as in the case of heart attack.
Yes, yes, sir. So, what are the
Yes.
symptoms? As you told, these are the alarming signs where the patient goes and attends to a cardiologist or a physician, and then gets themselves investigated. So what are the investigations which can diagnose them earlier? Invasive and
See,
non-invasive.
after prevention is the best thing. Let's discuss about the risk factors. What are all the risk factors which lead to this kind of heart attacks or stroke? This is called as a brain attack. Similar reduction in blood supply to the brain tissue is called as a brain attack. If it happens in the heart, it is called a heart attack. This happens due to 4 or 5 things: high blood pressure, diabetes, obesity, stress, lack of exercise and activity, and increased cholesterol levels. These are all the risk factors for a heart attack. How we can prevent this by following a healthy lifestyle. What we mean by healthy lifestyle is waist circumference. Waist circumference in men should be less than 35 inches, and waist circumference in women should be less than 32 inches in an adult. If we see the population, if we take a cross section of the Chennai population or Tamil Nadu population, 90% are above this level. This is the single most risk factor for any metabolic disease. Why this happens, why this simple obesity happens is chronic excess intake of food over a long period of time. See, you put fuel inside the mouth, but you don't use it. This fuel gets stored in the form of fat in the belly. This stored fats produces so many cytokines and other factors which cause atherosclerosis. Atherosclerosis is development of fatty plaques inside the blood vessels.
Yeah, yes, sir.
Yeah, yeah.
So these are the things which any person can keep in mind and work and keep in mind always the lifestyle changes which are very important. Prevention, as you told, is the best method to follow. So
See, I
what?
will tell one. I'll tell one thing which we should follow. All of us will stop cease growth at 18 years of age, because until 18 years of age, the bones can grow because the epiphysis hasn't fused. I used to ask patients how much were you were weighing at 18 years of age or when you entered college. Now, how much are you weighing? Most of the adults will be weighing at least 15 to 50 kilograms above the weight which they weighed during 18 years of age. The next question I ask is, where is this weight? Did the liver grow? Did your brain grow? Did your heart grow? Did your bone grow? None of these has grown. But you have put 10 kgs in excess or 20 kgs in excess. What has grown? The adipose tissue, that is the fat tissue, has grown. This fat tissue is not a good thing. It continuously secretes inflammatory cytokines, which causes this chronic plaque buildup inside the vessels. So this is the commonest risk factor. At present in Chennai, the incidence of diabetes is 25%. That is 1 in 4 adults has got diabetes. Another 1 in 4 adults have got pre-diabetes. Don't think the other 50% of the population is healthy. The other 50% has got either hypertension or obesity or dyslipidemia. To simply say, just 7% of the population is healthy in Tamil Nadu or in Chennai.
Oh
This
my,
is due to chronic excess calorie consumption. We have
oh,
to be conscious about what we put inside our food. Human beings are eating more than they should be eating. They're eating plenty, but they are not using it. It gets stored inside your body. This is the single most risk factor. This is the starting point of diabetes, dyslipidemia, hypertension, and all these things. By following good lifestyle practices, if you are able to reverse your obesity, if you are able to put off 5 kgs or 10 kgs or 15 kgs, I have seen people reverse diabetes, reverse hypertension. See how good it is. You need not be on medicines for lifelong. Otherwise, you need to continue it for lifelong, 30, 40 years. If you can shed off those 5 kgs, 10 kgs, 15 kgs, 20 kgs, you can completely reverse the disease, and you can be off pills. This is unheard of. Medical community is not acknowledging this. They say that once you are diabetic for lifelong. It is not so. This has been proved adequately by anecdotal studies, and we see it. I see it for myself. People who are able to lose weight. So how do we lose weight? Consciously reduce your food intake by 20%, 50%. Monitor weight weekly. Shed 1 or 2 kilograms per month. Try to come to as near as possible as you are weighing at 18 years of age. If you are able to do that, you can be assured that you will be not having any disease. 90% you can be sure.
yeah, that is a magical change in the body which happens at the when we do such things.
Yes.
Yeah,
See, you can look. You look. What are the other advantages? People want to look beautiful. If you you want to look beautiful, you have to shed your weight. That is the most important thing. What is the point in applying more and more? What to
Cosmetic.
say?
Cosmetics.
Single most thing, if you want to look beautiful, is you have to shed off your weight, excess weight. That's all.
Yeah, yes, sir.
There are many people who have lost 100 kilograms weight also. There are many success stories if you can go on the internet and see. From 287 kilograms to 70 kilograms, they have come.
Definitely.
Uh, in this light, this intermittent fasting carries, we need to mention about intermittent fasting. Finish your dinner before 6 o'clock. Have your breakfast after 8 a.m. So you'll be not having anything for 14 hours. This is the time your digestive system gets a good rest. All the waste products from your body gets eliminated. If at all you are developing some plaques, the body gets some time window for the plaques to be removed. Very good,
Yeah.
very good results.
Hmm. Yes, sir. I'm also following that and I'm seeing like magical result. And after a few months, if I give up, then slowly it starts to build up the weight. But when I'm
That is the
on, fully on, it's just magical. I can see.
yes.
So you also follow intermittent fasting, sir?
Yes, it's intermittent fasting. If you are motivated, you can even follow 24-hour fasting. See, all human beings should be able to continue with the normal activities with 24 hours fasting. Well, the 24 hours fasting method is to have your dinner. The next day, have that dinner again. 24 hours, nothing. Uh, each human being should be able to do this because you've got plenty of stores. You need not worry that you might faint or what to say. You might not be able to do some hard physical labor. Your stored fat will kick in to provide the energy. You might be feeling hunger, but that is not tiredness.
Yeah.
See, the single most important thing which can reverse all these diseases is losing weight. Mm, But on the contrary, if you continue to remain overweight and if you think that you can gulp a pill or two and prevent a catastrophe, I don't think it is going to happen because you're continuing with the bad lifestyle practices. And you think you're going to the 2 or 3 pills you're consuming will prevent catastrophe. It is common sense. I think it will not prevent.
Yeah. So when the system is completely gone wrong, then one or two pills, I don't think it will work.
Definitely, all the studies have also proven. But what if we have to offer something? You might get a 5% or 10% benefit. That's all, but not the total benefit. See, if you are able to maintain normal weight, the one greatest benefit is you might be having 5 to 15 years excess in life. If you are able to maintain a normal weight, 5 to 15 years. Think how big it is, how much you can earn.
Yeah.
It is a reward actually, and you'll not be having feeling the fatigue. Your knee joints will not be carrying those excess 15 to 20 kilograms. See, it is like a 50 kg person always carrying a 10 kg bag on this hand and 10 kg bag on this hand. You
Yeah.
feel how difficult it is. You drop this, then only you'll see what are the benefits.
Yeah.
Instead of carrying it in your hands, you carry it in your body all the time. The body is struggling to feed those extra 20, 30 kilograms. Your heart is not made up for that. Your heart was made up for probably 50 to 60 kilograms. Your heart was not made to supply blood for the other 30 kilograms. That is the clear cut reason. That is the clear cut reason that no one is talking about this. Simple obesity. 93% of the population is adult population is obese.
And indirectly also obesity leads to insulin resistance and then high BP also. So it's a cycle, vicious cycle, one provoking the other, and then it leads to ultimately all add on to heart diseases and atherosclerosis.
Yes. See, you rightly pointed out, doctor. High insulin level. Most of the population, if you do a fasting insulin level is one of the good predictors of metabolic health. If you do a fasting insulin level and it is less than 5, you are in a very good shape of health. The labs give the normal value as 5 to 25. That is not the normal value. See how they draw the normogram is they take the normal value of 100 people, but most of the population is unhealthy. So the unhealthy people also become a part of the normal average. That is how it. Most of the sports persons have a insulin level, fasting insulin level less than 5, 4, 3, 2 also. So do a fasting insulin level. If you are obese, most probably you will be having a fasting insulin level more than 5. And fasting insulin level also predates your diabetes by 5 to 15 years, because your insulin compensates for the increased blood sugar level. At the cost of increased insulin, your blood sugar is being under the normal range. This will be there for another at least for 5 to 10 years before frank high blood sugar develops. So that is the stage to intervene. Once you had a heart attack, you're going to have medicines, put those stents, bypass surgery. I feel it is you lost the time,
Yeah. The
all the
advantage
time.
of the time
Mhm.
where we can work on and then reverse everything.
Yes,
Mm, mm. And if we lose weight, the fasting insulin levels can come back to normal.
yes, yes.
Mm.
Try to get a fasting insulin level less than 10 and most probably less than 5. This high insulin now, what high insulin? High insulin is an anabolic hormone. Insulin builds tissue. So that is why high insulin causes smooth muscle proliferation inside the blood vessels. The blood vessel diameter inside it in the lumen is just 2 to 5 millimeters. It is just a small lumen. Inside that lumen, if your smooth muscle is going to proliferate, this lumen will gradually narrow. On top of it, the endothelium, that is the innermost lining of the blood vessel, is constantly being affected by the cytokines produced by the excess adipose tissue and high blood sugars. This endothelial injury is getting healed in the form of a plaque. So the lumen is constantly getting narrowed. At one point of time, if the plaque ruptures, there is 100% blockage, complete cessation of blood supply to the vital myocardial heart tissue. This is heart attack. You will feel severe excruciating pain inside the chest. At that time, you rush straight away. If you got an aspirin pill, you take a aspirin pill at home. Aspirin is a life-saving medicine. You can take it and just rush to the home. Your doctor will do an ECG and it will show, it will confirm an heart attack. Thereafter, you will be taken to the intensive cardiac care unit. There, you have got two options: either to give a medicine called as thrombolytic to dissolve the blood clot and restore the blood supply, or if you go early, like a cardiologist can do a procedure called as angioplasty or stenting, wherein they insert a tube through a blood vessel in your hand or a leg or a groin and go to the blood vessel supplying blood to the heart. The tube will go. And at the point of blockage, they will do a balloon angioplasty where the block is removed. And thereafter, he may place a stent or coil to keep the lumen patent. But after having this, you should continuously be on pills so that this stent doesn't get blocked.
Yeah. That a restenosis will happen. So,
Mhm.
so
Let's talk about the unhealthy foods. See,
yeah.
what are all the unhealthy foods? Number one unhealthy food is pure white sugar. Pure white sugar. Then second unhealthy food is oils. Plenty of oils. See, the oil. What is groundnut oil? It is an extract of groundnut. You're supposed to consume groundnut as a whole food. You're not supposed to consume groundnut juice, which is groundnut oil. Similar way, sesame oil. Any oil should be consumed in moderation. Here, the practice is to cook vegetables with oils. It is not a vegetable. It is a vegetable fry. Most of the vegetables are fried here in South India. You should make it as a boiled vegetable with little addition of salt and masala and all these things. Try to cook vegetables without oil. Just boil it and add some masala and consume it. That is one thing. Second most important thing is oil, you have said. The third culprit is white rice. White rice. Why I say white rice is white rice consumption was not this high until 100 years ago. Before 100 years in South India, the main staple cereal were millets. Rice consumption was just 10% of the population, that too near the delta areas, near what to say, Tanjavur and all these places.
They
Suddenly, the
uh,
last.
only during Pongal, this festival only they used to have white rice, it seems. That
Yes, yes, yes. See, what is special about white rice, and what is special about millets? White rice, the important thing is the brown covering over the white rice has been removed. That is called as rice bran. If you cook it with rice bran, the rice being digested will not happen so quickly Your blood will not have this surge of blood glucose from this rice. Once you consume it with the bran, once you remove the bran, the brown covering layer over the rice, it becomes pure white glucose. It is just glucose. That is why if you put white rice in your mouth, you just do two chews, it goes inside. But if you chew brown rice, you have to chew it 10 times. Then only you will be able to swallow it. For gram to gram, if you cook 100 gram brown rice and 100 gram white rice, you might not be able to consume 100 gram brown rice. You might be feel satiety within 50 grams itself. You will be on the whole consuming half of white rice. On the whole, you will be consuming less. You will not become obese. Similar case with millets also. White rice is pure glucose. There is no nutrient value. Most of it is glucose, less of vitamins and less of trace elements. This population, this South India population is mostly on rice. This is feeding this catastrophe.
Yeah.
So sugar, oil, rice, I would say. And fourth are junk foods, oil fried foods like murko, mixture, and all these things.
Zero fiber food like maida.
Ah, yes, there are,
Mm.
maida is the other white poison. Wheat, wheat if you grind it, you get wheat atta. If you make wheat into a white wheat, similar like brown rice, white rice, similarly brown wheat, if you polish it, you get white wheat. If you ground that to white wheat, you get what to say, maida. Maida is very, very dangerous for health. It is refined wheat.
So high glycemic index and lot of gut and other issues it happens, no, so while consuming
Yes,
maida.
gluten sensitivity and all these things. See, this population, our population is consuming 10% of vegetables and 80% of white rice. This is the common thing. Maybe other 10% is this mild amount of dal and all these things. You're supposed to consume 50% vegetables and 50% grains. 80% is, see, what is the typical breakfast? Idli dosa. For lunch, what is there? 2 cups of rice or 3 cups of rice with little sambar and puri. Again, what is the dinner? Maybe chapati. That is again another grain. Maybe little again same idli dosa and all these things.
What is your diet in at your place? How do you follow and maintain a proper diet? Fruits, like 50% you have fruits, or how much protein you add? Maybe what how do you manage in the busy lifestyle?
Or you are asking about whose lifestyle?
Your
Sorry.
diet pattern.
Oh, mine. Oh, I see. See, I consciously reduced my food intake. I want to be what I was at 18 years of age. When I entered college, I was just 48 kilograms. Until a year back, I was 64. So I understood. See, many people who see me used to feel that I was thin, even at 64 kilograms, compared to what others were. But I knew that I was obese because I used to have a baseline of 36 inches. I was 28 inches at 18 years of age. I was on the path to develop all these diseases. So I consciously reduced my food intake. What I did is I finished my dinner before 6 p.m. and I skipped lunch. I take breakfast and before 6 p.m. dinner. That itself reduced my weight. Unconsciously, I increased vegetables to 50% of these two meals.
Only two meal and no lunch and early dinner.
Uh, I think lunch is not necessary. Maybe you can have a breakfast at 9 and 5 p.m. You can have the same lunch and just close it down. That will give you immense benefit. It will be difficult because you have been accustomed to having 3 meals and your tongue has been accustomed to taste. But you were able to bring this change in your lifestyle. It gives you life expansion, can be off pills. You need not rush to an hospital in an emergency case as an emergency case. You will be feeling fresh. Your joints will not ache. You can be able to. You can move freely. And you'll be more productive also. Your sleep quantum will decrease. Apart from this, you should yeah. These are all the benefits.
So in between, do you have any snack or tea, coffee, anything?
In between, once you have a meal, you should give at least 4 hours gap for that meal to be digested. See, that meal is in the process of being digested in the stomach, and thereafter it moves to the small intestine for the nutrients to be absorbed. Once this food is being absorbed in the small intestine, you shouldn't put another meal in the stomach, because that meal needs to be absorbed and go into the large intestine as fecal material. So you shouldn't be constantly loading your stomach with frequent meals. This used to be an advice even among the medical community. Small, frequent meals. That is not a good advice. Usually, if you have a meal, at least give 4 hours to 6 hours gap. 6 hours to 8 hours is the ideal gap. That is that's a good thing.
Yeah, that's great, sir.
Small, frequent.
Hmm.
Hmm. Yeah, at least 6 to 8 hours gap between each meal is a good thing.
Yes, sir. Yes, sir.
If you want, you have to lose your weight. Otherwise, nothing is going to happen. And to lose weight, many people have tried this, doing excess activity like going for walking or going to gym, but they continue consuming what they used to consume. This method has failed many. If you want to lose weight, diet is the main thing. Second comes exercise and activity and gym. So people have tried only exercise, activity, and gym without modifying the food habits.
Hmm.
Many fail in that.
Yes, sir. The results will be fast when we incorporate proper dietary, as you told, a lot of fiber and vegetables and fruits, whole fruits, like that. So there has been some papers on intermittent fasting as it increases the cardiac diseases. What do you think about that, sir? Do you support it, or is it relevant?
See, these are all not large scale randomized controlled trials. I think there is a lobby behind it which wants the public to be chronically ill. If you follow fasting, it has been said from time immemorial that even our ancestors have said it is a
Mm.
practice. It is a practice. Mm,
And people couldn't
Nothing will
eat, no,
happen.
sir, because there was no light, there is no artificial light. They used to eat when the sun is up. They used to eat when the sun is down. They cannot eat or cook. So they
Yeah.
all finished by sunset, everything.
Mm.
So as you told this,
Absolutely, there is no fear about fasting. You will not have any problems because of fasting. You will have many benefits. These are all not proven studies. These are not randomized controlled studies. Maybe there is some intention behind these studies.
yeah, some people support intermittent fasting, maybe against them. There are some misleading, maybe information.
Mm.
And people were healthy, as you told, since yeah, decades or hundreds of years, millions of years, they had been fasting. And
See, we have seen there are people actually, there are anecdotal reports about people who have fasted for 84 days with just water alone. Because they have got plenty of stores of fuel. The anecdotal reports. There has been a report of a person who was just on oranges
yeah,
and lost a lot of
yeah,
weight.
yeah. Only
I
oranges
don't
we
think
had.
fasting will do. I don't think fasting will do
Mm,
any harm.
mm. See, she had only oranges for maybe how many months? Like 1 year, maybe.
That person was there on oranges for 1,008 days.
Maybe 3 years,
Yeah.
the 2.5 years. And one more thing I want to discuss is the Indian population seems to be slim outside, but they are not slim actually. It's thin outside, but they are very fatty inside. So,
That is called as TOFI, TOFI, TOFI.
yeah.
Thin on the outside and fat on the inside. All
Mm.
the Indians might look lean. Their arms will look lean, their neck will look lean, their legs will look lean. But if you see them, the belly will be protruding. Ideally, you should be having a scaphoid abdomen. If you see them from the side, your sternum should be projecting, your stomach should be inside, your abdomen should be inside, it should be curved inside. But uh, many don't have that. Very few have that. If you see some person who has got a scaphoid abdomen, you should probably be a teenager, 14 to 18 years teenager, or if you are or an adult who is actively very conscious about his health. See, this fat in the abdomen is what is the, see, this fat in the abdomen, it's not only in the abdomen, it also gets stored in the liver. Now, the single most commonest reason for liver failure is not alcoholism. Previously, 20 years back, the single commonest reason for liver failure was alcohol. Now, fatty liver disease, this fat accumulation in the liver is the commonest reason for liver failure. The single most common indication for liver transplant now
Transplant,
is
yeah.
not liver
Yeah.
cirrhosis. It is fatty liver.
Yeah.
What all you consume has to be stored in the body. It is being stored as fat predominantly in the tummy. So your liver is also in the tummy. This fat goes and occupies the space of liver. So there should be some liver tissue. Liver is supposed to do its work, but it is the liver tissue is being replaced by fat. So chronically, what will happen? The liver will lose its function. You will have jaundice, protruding abdomen, fluid accumulation in the abdomen. That is too late. Liver transplantation is the only solution.
I also got shocked. I was for some few days. I was in Rela Institute, Crumpet. So that time
Oh
I
yeah.
came to know, yeah, no, they were teetotalers. They never touched alcohol. They didn't have anything, any other viral infection, or they were very fine. Suddenly they had fatty liver for maybe months, and then abrupt onset of acute liver failure. So I also in young age like maybe 30, 25. What do you see, sir? What is the earliest onset age group?
You are talking about 2023 adults. You might be surprised. The incidence of diabetes and obesity in school children, adolescent school children from 8th standard to 12th standard, it is increasing. Some study puts 25% of the school children are obese. 25 to 40% of the school children are obese. See, just to check this, I used to go to films which were taken 30 or 40 years and see how people look like. Uh, Most of the films, if you see the people and children, they were thin. I used to do other thing also to see films which were taken before independence. Most of the people whom you will see in those films or maybe independence struggle kind of videos are they are all thin and having a scaphoid abdomen. But nowadays you can't find it. It's very rare to find it. So
Yeah.
this epidemic has developed because of this unmindful consumption. Fatty liver occurs even in school children.
Okay.
Maybe 40% of the adult population, 50% of the adult population, if you do an ultrasound, you might be able to see grade 1, grade 2 fatty liver.
Yeah, there is no space for deposition of fat. I hear that I read somewhere, so like the Western population, they're tall and gigantic. There is the mediastinum and the abdominal cavity is very huge. A lot of space to deposit. Other than liver, external to liver, there are a lot of other spaces to get the fat being deposited. But in Indians, we are not that tall, and the space available is very less. So it all gets deposited in the liver mostly, and of course a little bit in the and the blood vessels, and then atherosclerosis, fatty plaque, everything.
Yes, in the mediastinum, as you said, mediastinum, and surrounding the heart also. See, forget heart attack. Not only heart attack, this fat goes and encases your heart. So whenever the blood supply comes to the heart, your heart is not able to relax freely because it is surrounded by this fat mesh. This is called as diastolic heart failure. What you will experience is previously you will be able to climb up stairs without much breathing difficulty. Once this fat encases your heart, you will not be able to do that activity freely. This is called as diastolic heart failure. Heart is not able to receive the blood coming from your extremities. Previously, it used to relax this much. Now it is not able to relax. Just 50% of relaxation is possible. This is called as diastolic heart failure. All yes. And obesity is directly related to malignancy also.
Yeah.
Previously, cancers were very rarely heard of. Incidence of cancer is also coming up. I think the incidence of cancer is just 1 or 2 per 100. That means every 100 for every 100 normal people, 1 or 2 might develop cancer the next year. I'm not sure about this statistic. I think it is. I need to check. The incidence of cancer is also increasing. Lot of stored fuel. The body doesn't know where to metabolize it. Probably some tissue wants to grow and use this excess store. Incidence of diabetes, obesity, hypertension in the tribal population or native population, even now. For example, you can compare it, the incidence of diabetes with the tribes who live in Andaman. They are called as Sentinelese tribes. They have
Yeah.
done studies, Sentinelese tribes. They have done studies now. Incidence of diabetes, hypertension, coronary artery disease is zero now.
Yeah. Yeah.
Now, so what you have to do? You have to follow a diet like them. You have to be lean like them. That's all.
Actually, we
You,
went to
you can't take
Andaman.
a pill and have the same protection as them.
Yeah.
You believe in a pill and you believe that you will be having the same protection as them. It is not wise.
Yeah, our human body is designed to the when we went to Andaman, they showed us those tribes and also they are walking
Oh, great.
for miles and miles. They're walking for just to find food, and by the time they come back, it all should have been digested. They're all really fit. They didn't look like Indian. They look like a bodybuilders actually. Very impressive.
Yes.
Their health is too good, as you told.
That's what I wanted to say. That is the best example of bodybuilding. Like if you want to compare it, the bodybuilding with the tribes or a bodybuilder who does it in WWF or one who goes to a gym, that doesn't look natural. This bodybuilding of the Sentinelese tribe or any other tribe, it looks very attractive, I would say.
Yeah, and also flexible. That is inflexible. Like stiff,
Yeah, this
stiff.
bodybuilding,
Mm, mm.
this gym build-up is inflexible. They walk like this. They're
Yeah.
not able to bend easily. But the
Mm.
tribal population, you must see the videos now. You should compare. They will be having a scaphoid abdomen. Your abdomen will not be protruding.
Maybe they all have six packs, I guess,
Yeah, yeah.
naturally. Yeah.
Very nice. This is the curse of mankind, I wish I should say.
Mm. So this obesity is a pandemic become now, and mothers feeding their children and showing their love of the food and telling the children to eat, 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 and even after they finish, they give one more, some more dishes and let them watch the TV and eat, and so it's like going on loading the body with food.
See, this is a great point. What is the normal breakfast which children eat? Idli, dosa. At least one day, you could just give them. That's any day. You can just give them boiled vegetables. Another day you can give just fruits. That's all, just an apple or a banana. Go to school. And for lunch also, it is not necessary that you should keep white rice with sambar and poriyal. You can keep just a fruit, apple, or maybe a banana, or maybe an orange, or just vegetables alone, vegetable salad alone. It is not necessary that you should give carbohydrates for breakfast, carbohydrates for lunch, and carbohydrates for dinner. I have done this with my children. Some days when we are not intentionally itself, I just keep an apple. The thing is, after consuming this apple, you might not feel that drowsy after consuming an rice meal. You might be attentive also.
Yeah. We did this while in the yatra, like pilgrimage. We went to Himalayas and Kailash. That time we didn't have any snacks. It's just nuts we had. So we were feeling energetic. That's how I thought how much we would have ate when we if we had been at home. Not unwanted
This
food.
nut meal is also very good. Some days you can just keep cashews and groundnuts and almonds for lunch, or just cashews and almonds and badam for breakfast. Why is it that you should give only idli dosa for breakfast? This has to change. Constant carbohydrate loading of the children results in childhood obesity. I said it is 40%. So bring them away from carbohydrates, increase the vegetables, fruits, nuts intake.
Yeah. And how does fiber helps in avoiding and managing this metabolic syndrome of diabetes, obesity, everything, sir? How does dietary fiber supports our body in overcoming all this?
The fiber improves the satiety level. While you consume, if you can, and fiber increases satiety level. Fiber prevents constipation. Fiber adds to the bulk of the stool. Fiber feeds the microbiome. See, the large intestine has got trillions and trillions of bacteria. They need some food. Fiber is the food for bacteria. If you don't consume fiber, what will your bacteria consume? Your bacteria will start consuming your mucosa. Mucosa is the innermost lining of the intestines. Once the intestinal mucosal injury happens, gut translocation takes place. This bacteria moves from the gut into your bloodstream and it wreaks havoc. Fiber is important. See, the fiber consumption on an average in an Indian population is just, I would say, 5 grams, I think. I
Yeah,
think normally you should be consuming 20 to
25
30 grams of fiber.
around 25 to
How
30.
does your fiber come from? From the fruits and vegetables. When rice doesn't contain much of fiber. When you consume just 10% of vegetables and fruits, your fiber intake will be less than 5 grams per day. That means the bulk forming will not happen in the stool. Your microbiome will not get its food. You need to feed your microbiome also. Microbiome are a part of your body.
Yeah, they are our main. We are a host, and they they are not a guest. Actually, they are the main individual. I think maybe three-fourth or four-fifth of our weight will be bacteria.
You say I think 10 cells wise they are 10 times more than your body cells.
Hmm.
Cells wise they are 10 times more than your body weight. Body weight wise they might be equal to the other cells, as I said.
Hmm. Hmm. So the main component of our body is the bacteria.
Uh,
So we
it
have
is
to
one of
feed
the main
them.
components.
Hmm.
It is one of the main components. They are a part and parcel. They help in the digestion. Good bacteria helps prevent bad bacteria from being colonized in your intestines. All these things.
And if the fiber is more, it delays the slowly, the food is slowly absorbed, so the glycemic, the sugar spike is also delayed, and slowly there is gradual rise. Is it, sir?
That is the mechanism how brown rice acts.
Hmm.
Brown rice contains 4 times more fiber than white rice. So it promotes early satiety, and the sugar will not get absorbed instantaneously because
Hmm.
the sugar is mixed and intermingled with the fiber. So your body has to digest and slowly extract the sugar. That
Hmm.
is how high fiber foods act as low glycemic foods. That
Hmm.
is the mechanism behind their low glycemic action.
Hmm. Hmm. So, any other weight loss tips you want to share, so other than diet and how to exercise pattern? So, what do you do? Exercise or jogging or yoga? What do you practice? Or do you practice anything like meditation?
Regular walking exercises and all the physical activity you can broadly classify into three. One is just simple walking. Second is probably simple exercises at home. Third is intense physical workout at gym. Fourth is yoga asanas. Among all these four things, I will put the yoga asanas as first because all the other three things just work on the musculature. Yoga asanas work on the musculature and also on your mental system. That's how I see it as. It can make you feel less stressed, less anxious. It will help you carry on with your daily activities playfully. Of course, you will get a hit when you work in the gym also. But among these four things, if you consider health-wise, which is more beneficial than the others, yoga asanas first, gym workout second, third is simple exercises at home, fourth walking.
Yeah, yogasana is
Walking is the most simple thing. That's why
mm,
many people do that.
yeah, yeah. Yogasana is a wholesome, is a package of wholesome benefits, no, sir. And it's energy gaining. All others are expending energy and we feel tired. But this one, after doing, we feel more energized. And maybe we will lose weight also. And energy level also increases. Not like other gym and other activities, we may lose some energy and feel tired. That's what I feel personally.
Definitely, definitely. Doctor, could we break? I'm getting a call from the patient.
Sure,
Sorry,
sure, sure.
don't
Sure.
mind. We can
Thank you so much,
meet
sir.
some other day.
Thank you so
Okay.
much. Thank you for
Okay, welcome.
having me.
Nice talking to you. Thanks a lot for providing me this opportunity. I appreciate it.
Thank you. Thank you, sir. We meet again.
Namaste.
Thank you so much. Thank you.